Hello everyone, my name is Imad Sawiris. I'm one of the orthopedic doctors at El Sahel Teaching Hospital, Cairo, Egypt. As one of my disclosures, I run a clinical examinations course. For many years, I have noticed how residents and fellows struggle with the concept of measuring difference in length between lower limbs in orthopedic patients. I have therefore decided to create this concept map which simplifies the procedure and breaks it up into its logical chunks. With the patient lying straight in bed and limbs parallel, look below the heels, feel the medial malleoli for any difference in level, and measure from a point in the midline like the xiphisternum or the umbilicus to the medial malleolus on each side. This is apparent length. However, what you think is a difference in limb length may not represent a true limb length difference if the pelvis were tilted due to spinal deformity or there was a fixed deformity of the hip. Now adjust the pelvic position by squaring the pelvis. Bring the anterior superior iliac spines on both sides on the same level, making sure they are perpendicular to the examination couch. Ensure that lower limbs are parallel to each other and perpendicular to the anterior superior iliac spines. By squaring the pelvis, we can now measure true length. True length is measured from the anterior superior iliac spine to the medial malleolus on each side. If there was true shortening, you need to find out if this were on the femoral or tibial side. Bend both knees to 90 degrees with the hips and ankles at 45 degrees. Put the malleoli at the same level. This is Galeazzi test. Note the level of the knees and parallelism of the femora and tibias and comment knees at different levels, femora parallel, so discrepancy above the knee, that is to say in the femur, or tibias parallel, so discrepancy below the knee, that is to say in the tibia. Next, you need to find out if both greater trochanters are at the same or different levels, in order to decide if the shortening were supra or infratrochanteric by constructing Bryant's triangle. Identify anterior superior iliac spine with the thumb and tip of greater trochanter with the forefinger on each side. Note any difference in distance between the anterior superior iliac spine and greater trochanter, suggesting discrepancy proximal to the greater trochanter. Assess the perpendicular distance between points with fingers of the other hand and comment when Bryant's triangle is constructed. Perpendicular distance between points is different by x finger breadth. In some occasions, the two limbs cannot be brought parallel to each other. If the affected limb is fixed in abduction, place the other limb in the same position and measure the true length as usual. If the affected limb, however, is adducted, you have one of two options. You could either lift the affected leg and adduct the opposite one to the same position, in which case you shall need an assistant, or you could cross the legs, although this might not be very accurate. If the patient, however, had a fixed spinal deformity, by squaring the pelvis and making his anterior superior iliac spines perpendicular to the examination couch, you will notice that his trunk rotates to one side. By breaking this complex procedure up to simple steps, we have therefore created a concept map which will help us implement it in a logical sequence. Now think for yourselves about what you could do if the patient had a fixed deformity of the knee, be it fixed flexion, varus or valgus deformity. Next, I want one of you to come to the front and demonstrate for us how to measure limb length difference in this patient. Thank you.